All right, so we've got a few suggestions for helping the patient to dismount. Number one is you're going to have the patient basically pivot around a central point in the lumbosacral area and get their feet on the floor and keep their bodies straight and erect. Shannon, what I want you to do is use this area right here that I've got my hand on as a pivot point, and I want your shoulders to go that way, and I want your legs to go this way. I want you to, and as we're doing this, I want you to keep your abdominal muscles tight, keep the buttocks tight, and I want you to just pivot this way, and then when your feet hit the floor, I want you to use your hands to push yourself up straight. There you go. Okay, so that's one method there. Okay, let's go back down. All right, another method is to lower the table as far as it will go. We're going to have the patient basically do the same thing, but now we're going to have them get on their knees, okay? So again, let's pivot, and as you get down, just kind of fall down onto your knees on the floor. Yeah, there you go. That's perfect, okay. All right, now with a painful patient, that could take a good bit of time, a few minutes. But now what we're going to do is either using your elbows like this, or possibly your hands, we're going to raise you up, okay? And we're going to use the table. And as the table comes up, you just begin to raise your body and lift yourself up. There you go. That's it. Perfect. Okay. So those are two suggestions in helping the patient off the table. If the patient does not appear to be able to do either one, then the patient is going to have to get up on their own accord. That could take 5-10 minutes. No different than when they were trying to get out of bed in the morning. More than likely it took them 5, 10, or even 15 minutes to get out of bed. When they've been resting in one position for an extended period of time, it becomes difficult to put weight bearing on that injured area. Okay? So there's a few suggestions for helping the patient off the table.